We have such natural looking results. Like we make patients, look like a better version of themselves. And I really hope that brings more patients into the practices that may have been a little bit hesitant to try a procedure. They're afraid they might, look pulled or frozen or what have you. And so I think if you look at our results, patients would be really excited about that kind of outcome. So I think that's a big obstacle for a lot of folks. So how do we bring, new patients into aesthetics that maybe wouldn't have had these types of treatments in the past?
Hello, and welcome back to the Technology of Beauty, where I have the opportunity to interview the movers and shakers of the beauty business. And today is no exception. Today in our studio, we have Karen Cronholm. Hi, Karen.
Hi, Grant.
She's come all the way out from Boston to talk to us about a very exciting and new technology. So, first of all, welcome to LA.
Thank you. Yeah, I'm enjoying the warm weather. It's great.
I bet you are. It's great weather, isn't it?
Yes.
So, before we get into your technology, could you tell us a little bit about yourself? Where'd you grow up? Where'd you go to school? That sort of thing to start?
Yeah, sure. So I grew up in Massachusetts. I actually went to UNH. I'm actually a scientist by training, so I have a degree in microbiology, and then went on to get my MBA from Northeastern. So exciting.
Did you live in the Back Bay there, or when you were in?
No, but I've always lived in the Boston area. Really love it out there, despite the cold weather.
My daughter lived in the Back Bay. She went to school there at the Berklee College of Music.
Oh, nice.
So I had the chance to hang out there around Northeastern. So that's where you got your MBA.
Yes. Yeah.
And what did you do? What was your first job after that?
So, well, actually, I started off behind the bench. So, as a scientist in the life sciences industry, and then eventually found my way to Cynosure. So that's really where I got my aesthetic experience, and just really loved that job and had a great time. And when I heard about what Cytrellis was doing, I really just had to be involved. It was such a great idea and a great opportunity.
So what year did you go to Cynosure?
So I was at Cynosure from like 2008 to 2012.
Okay.
Yep.
And what did you do while you were there? What was your main?
So I managed the body contouring products. So I had Smart Lipo, Cellulase, and a couple other cellulite products as well.
Okay. Cool.
Yeah.
And then you were recruited to go to Cytrellis.
Yes.
Okay.
Yeah.
So is Cytrellis the name of the company or the technology?
It's the company. The technology is microcoring, and our product name is ellacor.
That's a lot. So ellacor, ellacor. How do you spell that?
ELLACOR.
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 That's the product.
Yep.
The company name is Cytrellis.
Yep.
Okay.
Yep.
And when did you move to Cytrellis?
So that was actually in 2015. And when I heard about the opportunity, like I mentioned, I just had to be involved. It's actually Rox Anderson and Jay Austin are two of the founders.
Yes.
So we have an exclusive license out of MGH. And it was just made sense. It's such a simple technology and just a great idea that they had. At the time, we actually hadn't done too much. It was real early days. It was more of an idea than anything else. And but when I heard about, hey, we're just removing these micro cores of tissue, so we remove the epidermis and the dermis. It's a full thickness core of skin that gets removed. And it just seemed so straightforward. And I thought, gosh, that's just got to work. That's got to make sense for, treating wrinkles and, reducing lax skin. And, from my days at Cynosure, we spent a lot of time on, developing products for those applications. So, I had a good idea of kind of, hey, what's working really well or what ideas might work even better. So that's, really how I wanted to be involved with the company and take things further and see if we could, really make it work. And we have made it work. We now have an FDA clearance.
Yes, congratulations. That's
you.
recent.
Yeah.
And have you been the CEO the entire time?
No, the founding CEO, Doug Levinson, he pulled the company together and did an amazing job putting together a group of great investors, KOLs as well, key opinion leaders, physicians that we worked with, and handed over to me in 2017.
Okay, so you've been at the helm for 4 years then, right? And now you have FDA approval.
Yep.
Let's go back a little bit before I ask you how you're going to roll this out, but let's talk a little bit more about the science and what actually happens. You've mentioned that there's coring, you've mentioned skin laxity, you've mentioned epidermis and dermis, but for the listeners and watchers, let's take a step back and redefine just what this technology is, okay?
Yeah, sure. So I mean, again, at the heart of it, we're just removing that epidermis and the dermis. And, if you talk to Rox Anderson and Jay Austin, our two founders, really their idea behind that was, how could we find a better way? When you're treating with, say, a fractionally ablative laser, which, Rox Anderson had a lot of involvement with developing that product.
Yes.
He always thought, well, why aren't I seeing, maybe a better tightening effect? And he theorized, well, maybe it's because you have all this coagulated tissue from when you use a laser and the skin doesn't actually close. So you're not really removing any tissue. And he thought, well, what if I could just remove the tissue not using any energy? So no heat, no RF, no radio frequency, ultrasound, anything like that, just a mechanical removal of the tissue, that the skin would collapse on itself and you just have less skin. So it's just as simple as that. His theory and Jay's work on the product as well really panned out. And we see that in our clinical studies, we're able to remove about 5 to 8% of the skin in a given treatment. And so really it's kind of a math equation, how much skin can we remove in one treatment versus multiple treatments, and we see better and better results with more treatments. And obviously being able to do that without causing any scarring. It's not a surgical procedure.
That's the question I have. How big are the cores that you're taking out? You're taking a core.
It's about less than 500 microns in diameter, so we're around 400 microns. And that there's an important science behind that as well. We definitely wanted to make sure we really understood the science and the technology really well. So we've done a lot of clinical studies to really hone into that right size and also right percentage of skin to remove to make sure we're getting great efficacy, but also a great downtime healing profile for the patient as well.
What is the downtime or healing for a patient, say they treat their neck?
So the patients reported to us in our clinical studies, it's actually about 3 days on average of downtime.
Okay. And these cores, are they a grid or are they individual? And how far apart are they?
They're a grid. So basically we remove skin with kind of a stamping technique.
Okay.
So the consumable that we have with the device actually has these tiny little super sharp microcoring needles that lay down a pattern within that 1 square centimeter. And we can either increase the number of cores that we remove or decrease them to change that percent of skin that we remove within that sort of stamp.
So you can change the number of coring devices in a given stamp?
Yes, it's adjustable.
Interesting.
Almost think of it as like a really simple robot in a way that we have incorporated with the way the device works. We have these very precise and accurate motors that control the needles, and we can position them anywhere in space.
Okay. And there's no energy involved.
Correct.
RF, ultrasound, you mentioned, no cautery, there's no bleeding per se?
Yeah, no, there's a little bit of bleeding during the procedure.
But it just naturally stops.
Sure, yeah. We advise that, physicians use a little bit of local anesthesia. And because...
Is that topical or injected?
Injected.
Okay.
Yeah. And so there's epinephrine in there that, obviously helps with the bleeding. And, but to control the pain, obviously lidocaine, patients report to us about a pain level of 2 during the procedure and then no pain afterwards. So I think that's a real big advantage of the lack of energy is there's no sustained pain, and the procedure itself is not very painful either with, the right anesthesia.
And that's on a pain scale of 1 through 10 or 1
yes,
through 5?
Yeah, 1 to 10.
Okay.
Yeah.
So a pain on a 1 through 10 is only 2.
Correct.
The procedure and post-procedure?
It's nothing.
0.
Nothing, yeah.
Any special dressings?
Nope. Just we recommend that, patients put Aquaphor on post-procedure.
Any contraindications?
We have a few that, we just a couple things we just like to be, cautious about. Obviously if somebody's had like filler in that area, we would want to be really careful about treating right over that.
Okay.
So certainly there's a few things that we like to make sure we include when we're talking to physicians. But, really it's a very simple procedure and we're not going that deep into the tissue. So for instance, you could treat over structures that, maybe you wouldn't with other heat-based technologies. So
How deep do the actual core biopsy or the core needles?
Yeah, we
go?
just need to be at the bottom of the dermal layer to remove the tissue. So, most people on average, they have, 2 millimeter skin thickness. So we make sure we go to about, say, 3, sometimes 4, depending on the patient, just to make sure we're going deep enough. But really doesn't impact the tissues underneath at all.
Now, if you're removing that 5 to 8%, whatever it is, and they heal, 2 questions. How soon could I have a second procedure, and how many procedures could I have?
So you could have as many procedures as you want. In our clinical studies, we did up to 3.
Okay.
So 2 to 3 to, achieve the efficacy that we were looking for. And then we did a regimen of 30 days in between treatments. But certainly you could, what we hear a lot from physicians is we could treat as soon as patients are healed.
And each time you lose, say, 5%, 5 to 8%.
Correct, yeah.
So let's take 5%. I could lose 15+% with 3 treatments.
Exactly.
Separated by a month.
Right. And one of the really interesting things we discovered is that we were able to improve these more severe wrinkles. So moderate to severe wrinkles is actually what we're indicated for.
Oh, interesting.
So not fine lines and wrinkles, which is what a lot of other products have.
Yes.
And we really targeted the mid to lower face area and able to address an area that not a lot of other technologies can really treat very well.
Now, have you treated the entire face, like the forehead, the eyelids, the cheek, and so forth?
We've just really focused on the mid to lower face.
Interesting.
Yeah.
And have you gone commercial yet? Is this a commercialized product?
We're just starting to roll out the launch and the products. So we have shipped our first system, which we're really excited about.
You have or haven't?
Yes, we have.
Oh, congratulations.
Thank you. Yeah.
That's wonderful.
But really planning on doing a big launch in 2022.
Okay, well, I certainly hope that you're launching at the Aesthetic Society.
Oh, of course, we'll
the
be there.
American Society for Aesthetic Plastic Surgery, my beloved society, in April in San Diego.
Yeah, that's a great meeting, so we will be there.
Thank you. Good. You will be there for sure? Great. Can you compare and contrast your technology with the Recros technology? Yeah,
sure. I think we're doing different things. I think that we're really focused on the skin. I know from what I've heard, they're going a little bit deeper into, trying to remove some fat as well. So a bit of a different application. And also, I think, again, we're trying to stick to the entire mid to lower face and really treating those broader areas. I would say the other thing that we've done differently as well is just the style or the manner in which we're removing the tissues different.
Can you explain that?
Yeah.
I'm unclear on that.
Yeah, so we have developed a method with these super sharp coring needles where we're just puncturing into the tissue and then removing the tissue. They don't rotate.
Okay.
Versus the Recros technology which rotates. So a little bit of a different style there as well. I believe our core sizes are much smaller as well. Okay. Which, again, as I mentioned, we studied that quite extensively. So we really feel that that's like the best way to, remove the tissue and, again, to get the best safety and efficacy that we can.
Uh-huh. Yeah. Okay. Well, thank you, because they both sound similar. When I just hear them, they sound very similar. But yours is straight in and out. Theirs is rotatory.
Yep.
And theirs is deeper. You said that includes
fat.
fat.
That's my understanding. Yeah.
Okay.
Yeah.
Okay. So tell me something. When you look in your crystal ball, where do you see the future of this industry, and in particular, the future of Cytrellis? I'm sure you have other things. If working with rocks, I'm sure you have other ideas.
Yeah, we have a ton of ideas. Yeah, we have so many ideas. I really see the device as a technology platform. So while this is our first indication for use for wrinkles, I think there's a lot more that we can do with the device.
Okay.
So there's a lot of applications that we're working on right now to, explore and, hopefully come out with additional indications for use, additional clearances. We believe really strongly in innovation. We're a very innovative company, and I have a team of brilliant engineers that are already working on the next great thing. So stay tuned for some more exciting products to come from us as well.
Any plans on going off the face and onto the body?
We'll see.
I think you're holding out on me. I think that'd be great because laxity is a big problem.
Absolutely. Yeah.
Anything you can do to help.
Yeah. The other thing I think I'm excited about with our technology is we have such natural looking results. Like we make patients, look like a better version of themselves. And I really hope that brings more patients into the practices that may have been a little bit hesitant to try a procedure. They're afraid they might, look pulled or frozen or what have you. And so I think if you look at our results, patients would be really excited about that kind of outcome. So I think that's a big obstacle for a lot of folks. So how do we bring, new patients into aesthetics that maybe wouldn't have had these types of treatments in the past?
I think you're onto something that way. I remember when you first presented it at the Aesthetic Innovation Summit, or AIS, and I thought the same thing. I thought there are some people that just do not want a facelift.
Exactly.
They don't want the cut. They don't want the scar. They don't want all the stigma and so forth. And this seemed like a way in which you could minimize some of the skin and thereby decrease the laxity and redundancy. And it seemed like a minimally invasive, not non-invasive, but minimally invasive approach to tightening and lifting. So I applaud your efforts. I hope you continue. And I hope you go off the body also. Because there's so many areas that patients ask us about all the time. And I love your concept of expanding the market because there are so many people that are looking for alternatives. And I want to thank you for coming here and spending your time here in the studio at the Technology of Beauty. We sure appreciate it. I look forward to having you back on the show as you develop these new applications of this coring technology.
Great. Thank you so much. It was a pleasure to be here.
Oh, you're very welcome. And I want to thank all of you for joining us once again at the Technology of Beauty, where I have the opportunity to interview the movers and shakers of the beauty business. You've just heard about Cytrellis and a very novel way to lift and tighten the skin with a multiple core biopsy type of technique. So join us every Tuesday, and you can hear our podcast or watch us on YouTube and go to thetechnologyofbeauty.com. Take care. Thank you very much.